During these times of uncertainty, we want to help as much as we can. That's where Help Delmarva comes into play. For those looking to pick up part-time work, we are compiling a list of places that are hiring, and we're posting them to that website. We've also compiled a list of businesses and restaurants that are open to help our local economy. And if there's something you'd like to add, just email helpdelmarva@wboc.com.
Speaking of helping Delmarva, the job these guys are doing, exceptional. This is staff at Peninsula Regional Medical Center in Salisbury, and we are sitting down with President and CEO Steve Leonard via Zoom today to find out how things are going. How you doing, Steve?
I'm doing well. How are you? Thanks for having me.
Doing well, absolutely. Thank you for making time for us, and thank you for everything that you and your staff are doing during all of this. Tell me a little bit about how everyone's holding up.
It's actually pretty surreal, if you might imagine. I think somebody told me the other day, not many people have actually lived through something like this. It's been so many years. The staff here are doing an amazing job. I have to say, one of the nice things about being on Delmarva, one of the many nice things, is we've had an opportunity to kind of see how things are unfolding elsewhere in the country, and it's really given us a little bit more time to prepare. But we spent the last several weeks even preparing more, making sure we've got adequate supplies. Making sure that our nursing staff feel comfortable, the frontline team, the doctors, nurses, all the folks who support them. And at this point, we're in good shape, and we're waiting for what is to come.
And so where do you guys stand right now with testing?
That's an area that's a little bit frustrating, a little bit of a sore point. I think it's a sore point across the country, actually, as at some point somebody will look back and say, perhaps, why as a country why weren't we in a better position with testing? At this point in time, when we have a patient who needs a test, we send it to the state lab across the bridge. We have 2 runs a day, and the results are usually back the next day, which is helpful. Or we send it to one of the commercial labs like the Mayo Clinic. I am happy to say that early next week, we will have on-site testing here. We're due to get the appropriate reagents tomorrow. We have to do some QCs in our lab. And then we can start testing to a limited degree next week for patients who are admitted to the hospital. We have to obviously just keep making sure that the supplies come, because a lot of this is falling on the device manufacturers, but we're getting to a better pace slowly.
PRMC is constructing a 43-bed COVID-19 intensive care unit, right?
Yeah, say that fast, right?
Oh, I was like, okay.
So as a part of the governor's plan for surge for the state of Maryland, they went to every hospital, basically said, we need you to develop plans to increase your ICU capacity by 100% and your med-surg capacity by about 30 to 50%. So we've worked through a lot of the details here at Peninsula, as well as our other hospital up at Nanticoke on how to do that. Our ICU normally has about 40 beds in it, and we actually have taken a conference center. Our conference center underneath the Layfield Tower in Hollowell has been converted to a 43-bed intensive care unit, essentially, to take care of these patients. So 2 weeks ago it was a conference center, and early next week it will be ready to house patients.
That kind of brings up my next question. Like, that's a huge change you guys had to make. Are there other changes, like, to regulations that are happening at the hospital that people need to know about?
Yeah, I think most people probably have heard about the stuff that's out there. We're no longer, we put a pause on elective procedures. We, like all hospitals, we've gone to no visitors. That's really to protect the public. We started wearing masks, all of our employees. I don't have one here. I'm in my office with the door closed, but if I go out into the building, we all have masks on. So it looks and definitely feels a little bit different in the hospital right now. We'll get through this, and eventually it'll get back to normal.
I know that you guys have had a huge amount of support from the public, but you want them to stay safe too, right?
Yeah, it's been great, actually. When we all look back from this, I think there's going to be things that we really want to see continue. It's been so nice. We've had people up at Nanticoke. The community came and chalked up the sidewalks, thanking healthcare heroes. I just got done rounding up in the unit that takes care of these patients and talking to the staff, and they're doing hard work on the front lines, but I can tell you the message is hitting them in just such a positive way. That and the food donations, and they're feeling good about really this is the time that they're proud to support the community, and what the community is doing has been great, and it's just been wonderful to see. Now, with that said, obviously, having people come on campus, we have to be careful of that. Yeah. So we did put some processes in place for people to share messages online, upload videos. They want to drop off signs, those types of things. We'll be happy to put them out. Just again, we want to keep people safe.
Absolutely. What would you say is like the number one message you want to share with Delmarva right now? I know a lot of people want to hear from you guys because you're doing
Yeah,
something.
it's hard to come up with one message. I guess I'd say is that we're here to support Delmarva. You know, when I think about hospitals and healthcare, obviously we want to keep people healthy and well. That's our mission. But at the same time, these are the times that we're proud to support Delmarva. And I don't think that, obviously that's not just Peninsula, being Peninsula and Nanticoke, AGH over in Berlin, I'm sure BB as well. All the hospitals are really doing their level best to support folks. I think the other message that I'd get out there is there's a lot of fear out there and concern. And I think I always try to remind people that the vast majority of people who may experience this, it's going to be fine. You know, a lot of people walk around and don't even know they might have it. They're asymptomatic. So that's why we're trying to get our doctors out there communicating with the public, because we have to distance, we have to wash our hands, and the vast majority of people who may experience it, it's going to be fine. So do what we need to do now in the short term. It'll be better in the long term. And if folks do need that more acute care, we're here. And we're prepared, and we're going to support the community as we work through this process, and hopefully get as much summer back as we possibly can.
Absolutely. And we just thank you guys so much for everything you're doing, and just keep on fighting that good fight.
Yeah, it's a great team, and we're incredibly proud of that team up on the floors and in the ER taking care of folks. So thank you for having us.
Thanks so much. Jimmy and Lisa?
And Jimmy, one thing that I like about PRMC is that they are really keeping everyone informed on what they're doing, step by step by step, letting us know what's going on. And I think a lot of people appreciate that.